blood pressure monitoring and the danger of acute hypertension. Number 1344, September 1, 2025. Gerald C. EclaireMD Foundation. Category: Hypertension and Stroke. Introduction. Blood pressure, BP, is not just a number on a chart. It is a dynamic marker of both long-term vascular health and short-term stress responses. Traditional medicine often focuses on averages, like systolic blood pressure, SBP, and diastolic blood pressure, DBP, measured once or twice a day. But my own history shows that averages can be misleading. On June 21, 2025, a sudden surge of SBP to 175 mmHg caused a hemorrhagic stroke in my brainstem. It was not the average numbers that hurt me, it was the one-time spike. My monitoring approach. After this event, I started an intensive self-monitoring program. In retirement, I can devote my time to collecting and analyzing my own health data through engineering, mathematical, and biomedical perspectives. For 2 months, I measured my BP 24 to 30 times each day with Omron, wrist and upper arm devices. I also tracked my heart rate, food intake, exercise, sleep, hydration, emotions, and medication timing. This produced about 3,600 readings in 60 days, plus more than 2,000 detailed food and lifestyle records. I plan to extend this to 30,000 BP and HR readings in 1 year. Results. On the surface, my average BP looks good. SBP, 115 mm of mercury. DBP, 70 mm of mercury. Pulse pressure, PP, 45 mm of mercury. These numbers suggest good control, but averages can hide danger, just as my MIT advisor, Professor Norman Jones, studied in his 50 years research on dynamic plastic loadings in structures and machines. Similarly, my past 16 years of disease and lifestyle research have also focused on extreme cases rather than averages. I recorded 2 spikes during the last 60 days, 143 mm of mercury and 149 mm of mercury. Both were tied to my emotional stress during legal discussions about my last will. This shows how psychological triggers, not just diet or activity, can provoke dangerous surges. What the spikes mean. In younger people, arteries act like shock absorbers or flexible water pipes, buffering pressure changes. With aging, arteries stiffen, and the shock absorber, the vascular elasticity, is lost. For me, stroke risk is tied not to the average load, but to the amplitude and rate of rise of spikes. A single surge can be enough to rupture a fragile vessel, leading to either a heart attack or a stroke. My past 2 months average PP of 45 mm of mercury, slightly improved from my last 2 years, but still above the ideal of 40, confirms the presence of vascular stiffness. Lessons learned. The key lesson is that averages do not protect me. Acute surges are the real threat. Clinical guidelines focus on keeping SBP below 120 and DBP below 80. I meet those targets, but they did not stop my stroke. In just 2 months, I saw how emotional stress produced my blood pressure spikes. That could trigger another crisis. Over the next year, I will expand monitoring to build a detailed map of my vascular responses. My goal is to separate random fluctuations from patterns linked to food, exercise, hydration, and stress. For me, this is not simply data collection, it is survival. And for others, it is a reminder that medicine must look beyond averages to protect patients from sudden and deadly events. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be edited or republished as your own.